Hello friends, today I'll be discussing with you the role of diet modification and lifestyle on treatment of polycystic ovarian syndrome. First, let me tell you what is the difference between PCOD and PCOS. PCOD is simply finding ovaries which have got multiple cystic lesions. That's polycystic ovarian disease. But when you have multiple other symptoms such as obesity, excessive hair growth, acne, irregular periods, scanty flow, infertility, a combination of any of these symptoms, then we call it PCOS or polycystic ovarian syndrome. So just finding that bulky ovaries in an ultrasound is not a cause of concern, because that can be a finding in growing years during some part of your life, but unless you have symptoms, there's nothing to worry. The talk is mainly on the role of diet and lifestyle changes. So what is our diet? Diet, when we talk of that, we mainly are concerned about how much calories should be taken and what should be the food combinations we should be able to take. Especially in India, the food habits are different from what it is in other Western world. Women of adult age who are performing moderate work, there the caloric requirement per day is 2000 kilocalories per day. Now in PCOS, we don't want to give so many kilocalories because your body is not able to handle them, and that is accumulating everything as fat. So here the requirement for an adult woman who has moderate working pattern is 1200 to 1500 kilocalories per day. Now what is a food combination? The food consists of three main constituents, namely the carbohydrates, the proteins and the fats, and there are vitamins and minerals in different proportions. So what should a ideal diet be? Your carbohydrates will constitute about 50% of your meal, proteins should constitute about 30 to 35% of your meal, and fat should constitute remaining 15 to 20%. Now talking about each component. So when we talk of fat, so let us start with carbohydrates. Carbohydrates are there, they are inevitable part of your meal. You should not omit completely carbohydrates from your diet. But our focus should be on carbohydrates which have low glycemic index, GI. What is glycemic index? Whenever you eat anything, it gets converted into glucose and causes a glucose rise in the blood. And that causes release of insulin. We don't want the body to give a shock by releasing large amount of glucose instantly into the blood. We want some food items which will gradually release glucose so that insulin can be released in a stable way. So this is called the food with low glycemic index. What is high glycemic index food? It is white rice, sugars, sugar containing eating items. But low glycemic index foods are brown rice and highly refined stuff. So in carbohydrates, what you should include and what you should avoid. You must include in your diet high fiber carbohydrates or brown rice, millets, oats. They are good source of carbohydrates, good carbohydrates. Whereas one should avoid white rice, refined flour things such as white bread, pastas, noodles made of this refined flour, and high sugar containing food items such as ice creams, sugar containing juices, drinks. They should be avoided. So this was all about carbohydrates. Now let's talk of proteins. So proteins should be about 30% of your total diet. The best quality proteins which a human can have is that found in eggs. But not everybody takes eggs or non-vegetarian food. So for vegetarians, we have pulses, cereals, sprouts, dairy products which are rich sources of proteins. And other sources are fish, meat and egg. Then and proteins, the important part about proteins is it gives you satiety. That is, you don't feel hungry if you have a good protein diet in your meal. The third component of a meal is fat. So low fatty diet when we say, what does it mean? Fat is required for cooking. When we use oils, there are various types of oil. Some are good oils, some are bad oils. Just for your understanding, I am simplifying it this way. We must avoid oils which are saturated fat, such as in Indian homes we use a lot of ghee, which is saturated fat, which should be avoided. And unsaturated fat is oils derived from plant source, such as sunflower oil, corn oil. These are all derived from the plant sources, so they are all good. But what nutritionists they say you should use combinations. You should not just stick yourself to one kind of oil. Use different types in your different meals. Then coming to supplements, vitamins and minerals. They are essential parts. So if you take good amount of fruits and vegetables, you are taking almost a bit of everything, and they are a rich source of vitamins and minerals. Vitamin D deficiency is often found in polycystic ovarian disease patients, so PCOS patients. So vitamin D normally you get only from sunlight, but if your vitamin D is low, your doctor will tell you, and she'll give you supplements, which are usually once a week sachets or capsules or daily capsules, which will be given for a prescribed time. Antioxidants such as omega-3 fatty acids are good, and you can among other minerals, there are a lot of minerals which are as the researches are going on, we are discovering that a lot of trace elements and minerals might be also contributing to PCOD symptoms. Chromium is one of them. Chromium is found in tomatoes, broccoli, pear. So these are the fruits which contain chromium. How much fruits you should take and how much is salads, we say take salads, how much salads or green leafy vegetables. So for an adult woman, about 100 grams of fruits and about 100 grams of green leafy vegetables per day is recommended. So this is what I wanted to say about diet. Now let's talk of lifestyle changes. With lifestyle, I mean sedentary lifestyle or active lifestyle. So whenever a PCOS patient goes to a doctor, the first thing doctor will say is weight reduction. Some of them are lean PCOS and some are obese PCOS. Even if you are a lean PCOS, your daily workout will help in, not only we are not focusing on weight reduction, it will help in changing the metabolism or the internal changes which have led to PCOS and improve your disease. So how much exercise is sufficient? What exercises should I do? About 30 minutes of active exercise. So 30 minutes is minimum, I would say, and 45 minutes is good amount of time which you can invest in doing exercises. Exercises should be in the form of something aggressive, something which makes you start sweating. If you're strolling, are you able to comfortably talk to your friend or your partner? That's not, probably you're not putting in all your efforts. You should be walking at a pace that you are little slightly breathless and you're not able to, you should start sweating when you start doing brisk walk. So brisk walk is one of them. Cycling, jogging, swimming, and nowadays we have such nice forms such as aerobics, Zumba classes women usually have in their residential societies. So you can join any one of them which causes anything which makes you sweat, and 30 to 45 minutes. Sometimes because many of you are office going, so many times you will miss your exercise. So try to be as regular as possible, but at least put in 3 to 4 hours in a week on regular exercises. It is easy said than done to reduce weight, but then you will find that a month or so you will be very obediently you will try to do the workouts, but if you don't find the weight going down, you may get demotivated. So 1 or 2 tips for this I would like to say. Involve your partner also. If you are a married lady or if you are you have friends, involve let it be a team activity so that you together you remain motivated. That's one. And secondly, slight reduction in weight, even if you lose 5%, that will have tremendous effect, positive effect in improving your disease. So don't give up. Don't go by whether my weight is getting reduced or not, because probably when you go to your doctor you find it was 87, this time it is 87.2, although you have been doing vigorous exercise. Don't get discouraged by such things. Your daily activity will lead to various beneficial effects. One is weight reduction, definitely. Then the insulin which has become resistant, your body has become resistant to insulin, that sensitivity comes back. So the internal system which has gone there has been an imbalance, that will get corrected. Thirdly, there will be estrogen which is deposited in your fat cells all around, that will also become less because it is also a state of hyperestrogenism. Fourthly, exercises cause release of happiness hormones, we call them endorphins, which in some way or the other will help you in your overall well-being.